Hello everyone, welcome to sqadia.com, and in the fourth section of the lecture topic acute pelvic infection, we will talk about the infections after delivery and abortion. In this section, we will talk about the pathology associated with the infections after delivery and abortion, how these infections present, and what's the management and treatment of post-abortal and postpartum pelvic infections. Pelvic infections which follow delivery and abortion are usually caused by anaerobic streptococcus, staphylococcus, non-hemolytic streptococcus, E. coli, and Bacteroides group. The pathology of the post-abortal or postpartum pelvic infection is usually, as any other infections, there is once the infection is present in the endometrium, which is the endometriitis, because usually the endometrium is affected after the abortion or when the D&Cs are performed. Endometrium is the site where the D&Cs are performed. So endometriitis is very, very common after the abortions. In this, the endometrium of the uterus is involved. From the endometrium, then the infection can go to the fallopian tubes, and then it can lead to the peritoneum, peritonitis, salpingitis. It can lead to ovaries, causing ophoritis, and then it can also lead to the bloodstream, base of the broad ligament, and then base of the broad ligament, and then it can lead to the cellulitis. And there is here it shows you the placental side or cervical laceration. So the instrumentation during the delivery or instrumentation during the abortion can involve the endometrium. From the endometrium, endometriitis can spread to the tubes, causing salpingitis, and then to the ovaries, causing ophoritis, and then from the ovaries it can spread to the broad ligament and then can cause cellulitis. So it can spread anywhere in the body. Some clinical features, it is divided into acute and insidious. The chief complaints are usually there is fever and lower abdominal and pelvic pain. Signs and symptoms are patient look ill, restless, like to lie on her back with legs flexed. Flexed are the bending of the legs at the knee. Patient like to lie on the back with the legs flexed. That gives them little relief in the pain. Pulse is very rapid, and there is abdominal tenderness present. On vaginal examination, usually there is discharge, purulent, painful, and offensive, foul-smelling discharge. Uterus is tender, and there is tenderness on the movement of the cervix, and there is usually a mass felt on the unilateral or bilateral examination. The complications are usually there is endotoxic shock. Patient can go into the shock. Shock is a condition in which the patient can even become unconscious. Blood pressure is very low, and it's endotoxic because of the septicemia. Infection spread through the bloodstream or to the different parts of the body. Blood pressure becomes very low and patient can go into the shock. There is oliguria, very, very less urine or even no urine, anuria. There is disseminated intravascular coagulopathy, DIC. DIC is disseminated intravascular coagulation. Blood is clotted and in the vessels it's present. So, and there is tubo-ovarian abscess, peritonitis, and there is thrombophlebitis, inflammation of the veins. So if you see the complications of post-abortal and postpartum infection, you can tell that it's a very, very serious condition, and it can even cause the death because of the shock and septicemia and DIC. Prevention is how we can prevent this serious condition is to maintain asepsis during the labor. It's important that delivery should be performed under complete hygienic conditions. Usually the deliveries in some areas, there are deliveries performed in homes under unhygienic conditions, and these are the circumstances which can lead to these conditions. And then to avoid trauma during the deliveries, to use prophylactic antibiotic when labor is delayed, and to encourage family planning to prevent any unwanted pregnancies, because unwanted pregnancies usually lead to abortions. Next was the management and treatment. Usually the routine investigations and special investigations are performed. In the routine investigations, usually blood tests, complete CBCs, and then blood cultures, these things are done, and then we have special investigations also. Hospitalization is sometime required. Then triple swab testing, vaginal and rectal examination. The treatment is antibiotics, which include gentamicin, 2 milligram per kilogram body weight. Clindamycin is given intravenously, 600 milligram daily with IV metronidazole. Then supportive therapy is blood transfusion for anemia, treatment for shock, renal failure, DIC, and all these are serious condition and has to be treated on emergency basis if shock is present. Surgery, evacuation of the uterus, posterior colpotomy, and laparotomy. These are the surgical procedures that can be performed. So that was all about the management and treatment of the post-abortal and postpartum pelvic infections. Thank you for watching sqadia.com.